today. We're super happy to have Dr. Davis joining us again today. We had a webinar that was rescheduled yesterday afternoon or evening at 5, which was just really great. So I'm super excited for this provider-facing training. So a bit of information about Dr. Davis, Kyle Davis, is that he is a licensed clinical psychologist specializing in clinical health psychology and behavioral sleep medicine, including cognitive behavioral therapy for insomnia. He has specialized training in mood and sleep disorders, chronic pain, weight management, and primary care mental health integration. So we've had Dr. Davis present with us several times in the past, and we're just super grateful that we have a great relationship with him. And I will hand it over to him to start presenting.
Yeah, thanks for having me again. So if you were in the presentation yesterday, you're going to find that this one is fairly similar. And the main reason why is we were talking about how culture influences mental health, and that's no different if you're somebody seeking resources regarding mental health, or if you're a therapist, thinking about how you can better meet the needs of men. One thing, I was thinking about my relevant experience, and one thing that I didn't even bring up yesterday is that during some formative years in my training, so in an internship and a postdoc fellowship, I was working within the VA healthcare system, so down at the San Diego VA as well as the Boise VA. And I often think back to that time and how much I enjoyed working with the veterans. And in that place, the vast majority of patients you're working with are male. And so I didn't even think about that as relevant experience for me, but it's definitely a male-dominated place where we actually were delivering lots of mental health care to men. So anyways, thank you all for joining us today. Let's go on to our objectives. So we want to talk more again, so some of the same conversation we had yesterday about how culture can influence the presentation of mental health conditions in men. We'll talk a little bit about differences in prevalence of mental health conditions associated with gender. We can understand how postpartum depression can affect men. And then what's a little bit different about this presentation is we'll talk more about why men may be less likely to utilize mental health services, and then talk a little bit about utilization rates in general and how we could potentially improve those. And then for anybody who is a therapist, we'll talk about how you may be able to adapt treatment approaches or think a little bit differently about how you may be approaching men to better fit their needs. So quickly, I see a few different names in the crowd today. I make use of the chat box a lot during my presentations. If you can hear me, and can you please type into the chat box? And the other thing that I want to know is if you are a therapist. So any counselors or therapists out there, or maybe even like peer support specialists. I'm just a little curious about who my audience is today so that I can help meet your needs. Okay, Aaron's cool. You're in grad school for counseling. Okay, Tiffany, you're just here to learn more. Thank you. All right, anyone else? Oh, Aaron and Tiffany are friends. Great. Okay, and Will, you're a former peer support specialist. Okay, cool. I have a feeling once you're a peer support specialist, always kind of a peer support specialist, even though that may not be a formal job for you. All right, well, thank you for sharing that. And also welcome to our chat box where we're going to be having more conversation. So let's talk some about how culture can influence mental health conditions in men. And the way we started this off yesterday is we say, boys are often taught that in order to be accepted by their society, their culture, they need to express masculine traits. So the question for you all is, what qualities do you think are traditionally considered masculine? Like if you were to make a checklist of masculine qualities, what would you include there? Oh, and thanks for your response, Katrina. I appreciated your engagement yesterday. All right, so what do y'all think? What is a masculine quality? Okay, Will says strong and silent. Okay, yeah, because our society doesn't reinforce men for being more sensitive. However, as we know, plenty of men are sensitive, and it kind of puts them in a weird place if you feel something differently than how you're expected to be, which is a big part of what we talk about today. All right, thank you so much, Will. Anyone else have anything to add there in terms of masculine qualities? Even if you were on the talk yesterday, it probably is nice for your peers to see you typing into the chat. Okay, yeah. So, once again, we've got strong, and then you can feel emotions. Like it's okay to express emotions, like anger, but not more feminine ones. I love your quotes there. And being tough. Okay, being self-sufficient, self-reliable, not needing help. Perfect. That's exactly the kind of stuff that I was thinking about as well. So, when you review some of the definitions of masculinity, these are the kinds of things you find. So, being self-reliant, stoic, not expressing emotion, anti-femininity sometimes. We'll talk just more about that in a second. Really reinforcing achievement, not showing any weakness, so therefore showing strength that you all were mentioning. And then also things like adventure, risk, and glorifying violence. We were talking a little bit yesterday about, I think sports is a place where this comes up a lot, when you think about some of the most popular sports out there, men's sports. We have things like football, which is pretty violent, and then other things that are even like just straight up fighting, like boxing and mixed martial arts. And, these are some of the most popular sports. And this is, really kind of glorifying some of those aspects of masculinity that could be helpful, but also oftentimes are also harmful to men. And then a little bit about that anti-femininity. What's an example of how men may experience this? So, like, what are things little boys are told, like if they're feeling sad or they're expressing feminine qualities? Okay, so yeah, so stop crying. We may tell a little girl that it's okay to cry and it's okay to express her feelings. But a little boy, we'd say, stop crying. Like in my picture here, man up, walk it off, suck it up. And, even like very literally, we oftentimes hear like, don't be a girl. We use it in a pejorative kind of way. Somebody yesterday said like, don't be a sissy, don't be a wuss, don't be a girl. And so, where society is telling, little boys that these things are not okay if you're going to be a man. So we'll talk a little bit more about how that could influence mental health. Well, actually, I'm going to ask you first. How do you think those qualities could influence the mental health of men? So we've kind of painted this picture here where men are only allowed to express certain things that they may be experiencing or feeling. And how do you think that influences their mental health? We'll use the chat box here again. Yeah, Will's saying more stress. And part of what that comes from is we can call it cognitive dissonance, and that's when you have to act a certain way, or you are acting a way that's different than how you feel or who you think you are. So the more of this dissonance that we're experiencing, the more we're likely to experience stress. So if I'm a man and I feel emotions really strongly, and it's not culturally acceptable for me to express those emotions, there's a big disconnect between how I feel and how I'm allowed to act. Oh, these are some great comments coming in, Aaron. Okay, so men feel like they aren't allowed to feel all their emotions. They may not want to go to counseling because it shows weakness. I think I have that verbatim almost on an upcoming slide. And then holding themselves at toxic masculine standards can make them feel like they aren't man enough or men enough. Yeah, that's exactly what we're talking about here. And so, if I can express some of the emotions I'm feeling, those emotions are going to come out one way or another. And so I'm more likely to express emotions like frustration, anger, rage, or find other or like more isolated ways of experiencing my emotions or expressing them. So thank you for those comments. I think you all are right on here. So yesterday, I tried to show a little video from the American Psychological Association. I think I know why it wasn't working yesterday, so I'm going to try again. But please let me know in the chat box really quickly if it's not working, and then we can move on from that.
Boys don't cry. That's what they taught me. Why do I have to prove myself? He taught me how to fight. Right hand, left hand, right hand. Come on, hit me, hit me, hit me. Come on, hit me. Come on, man. You taught me not to show emotions. Told me I need to man up. What you doing, man? Get off me. Get up. You told me boys don't cry. So what am I?
This man up piece is extremely important because it's playing out in real life. Our young men, they feel pain and they don't feel it's okay to express it.
We all have feelings. They're part of the basic equipment of being human. Some poets and philosophers say emotions are what makes us uniquely human and separates us from the animals.
The idea that it's not okay to express their emotion is not working. And it's playing out later in life. It's causing them problems. It's causing inability to achieve, inability to thrive, inability to be in a positive relationship because we're emotionless.
You can teach him masculinity means responsibility and respect to others. It means good character and morals, and a level of autonomy and independence that matches his maturity level.
It's okay to be vulnerable. It's a safe space. But our boys need to know that the family's a safe space. Look, I'm your father. I'm a safe space for whatever it is that you're thinking, whatever it is that you're feeling. It's a safe space for you to express it. And we're going to work it out. Why? Because I love you. I love you. First.
All right, so thanks for watching that little video. What did you all, what are your reactions to that? Does this seem consistent with what we were just talking about? I think it's so poignant in that, you know, they have this picture of that little boy crying, and he says, you know, so what am I? You know, if boys don't cry and I'm crying, you know, that's part of that cognitive dissonance that I was just talking about, which creates more distress for the person experiencing that. So now they feel like they have to be something that they don't feel like they are, and that causes problems for anybody who would experience something like that. All right, any reactions to that in the chat box? Yeah, I appreciated that too. And it's really just kind of this idea of acceptance, you know, accepting people for who they are and not holding them to some ideal that is, well, it's not even ideal. It's just, you know, the cultural expectation. So, yeah, just acceptance can go a really long ways, but I'm probably preaching to the choir there. Yeah, good point, Tiffany. So yeah, you know, not feeling like you have a safe space anywhere to express how you're feeling. Oh yeah, and then if you do express emotion, then it's like, oh, that's you know, that's an undesirable kind of thing. So, which just reinforces this idea that it's not really acceptable, but maybe that's just, oh, he does that, you know, but that's not who he's supposed to be. That's just that's a weakness in him. Oh, I did not mean to play that again. Okay, so I think you all, you know, really have your heads wrapped around this. But if we get a little bit more specific about this, you know, why do you think some aspects of those ideas about masculinity, why would they lead to specific increases in things like impulse control disorders? So things like conduct disorder, oppositional defiant disorder, intermittent explosive disorder, increased rates of substance use, and as well as suicidality. Why would we see those things in men more than women? Aaron, you nailed it. Yeah, so not having a healthy outlet for their emotions could lead to those issues. And so, you know, what we see our men are expressing themselves or coping with things in a social, in a more of a socially acceptable kind of way, or maybe a socially expected way. So the way that I was thinking about this, so expressing feelings that are incompatible with masculine ideals could be taboo or unacceptable. So like if I'm expressing emotion, I'm crying, you know, that could be unacceptable. If I am, you know, having fun playing with a doll as a little boy, I learn that, or I could be taught that that's taboo or unacceptable. And of course, what we know is, well, we have a choice in how we treat children. And then that can have an influence on how they learn to express themselves. So anyways, if somebody is feeling something that's unacceptable, or they're told that it's unacceptable, then what happens? Well, they're more likely to act out in those more socially expected kind of ways, like acting out with violence or anger. They may be more likely to numb their feelings with substances, because those feelings are there and they are not expressing them. They're dealing with them somehow. So this is coming out. And they may be more likely to harm themselves and maybe complete suicide. The example I used yesterday that I think is really relevant to stressful situations in general, and definitely applicable to what we're talking about right now, is you can think about all these stressors that people are experiencing. You're trying to avoid feeling these emotions. And the way I think about it is like holding a beach ball underwater. So I've got all my emotions and I'm trying to suppress them and keep them away and hide them. But eventually I reach a breaking point. There's too much stuff going on. I'm too stressed. and I can't keep the ball underwater anymore. And what happens? Well, it explodes up, you know, and that's when people are more likely to express their emotions in unhealthy kinds of ways. And like I said, I think that's applicable to all people that are experiencing stress or avoiding emotions, but I think it fits what we're talking about. All right, so let's talk a little bit about rates of mental health disorders in women and men, and then we'll get into more about what we can do as society, healthcare systems to try to help men out more. So we see increased rates of mental health diagnosis, or for most different types of disorders in women than in men. So with anxiety disorders, specific anxiety disorders like panic disorder, phobias, post-traumatic stress disorder, obsessive compulsive disorder. And then we also see increased rates of major depression in women. Interestingly, I think you see very similar rates of more serious mental illness like bipolar disorder, schizophrenia in men and women. But then you see these increased rates in things like impulse control disorders and substance use disorders. With men, almost twice as likely to experience a substance use disorder than women. Is that surprising to anyone? Is that consistent with what you see in your lives out in the field? I primarily treat insomnia these days, and that's definitely more prevalent in women than men, but I'll save those reasons why for another talk. Okay, and I've got a couple slides here about suicide rates, and the way to understand this graph is the green line represents suicide rates for men out of every 100,000 individuals. So men are completing rates of suicide about 20 for every 100,000 men in the United States, where women are completing suicide at a rate of 5 for every 100,000. So men are 4 times more likely to complete suicide than women in the United States. So pretty dramatic difference there. And then that also holds up across the world. So the way to understand this slide is you've got your male suicide rate on the y-axis, and you've got your female suicide rate on the x-axis. So anything in the upper quadrant of this graph, or the top half of that line that splits down the center, is showing rates that are increased in men more than women, which we can see that they pretty much all are. It's only equal in a few countries and never more prevalent in women than men. With the most extreme example in Greenland, where we have approximately 25 women completing suicide for every 75 men that complete suicide. So very high rates of suicide in Greenland. But we see a similar pattern in all these other countries here that are listed. And like we said, United States was approximately a 4-to-1 ratio. Another interesting fact about this that you all are probably familiar with is that women are more likely to attempt suicide, but men are much more likely to complete suicide. And the reason why that is, well, men oftentimes choose more lethal means of attempting suicide, and so therefore they are more successful in completing. And then one slide here about paternal postpartum depression. You know, in consideration that next weekend is Father's Day, we need to recognize, you know, that this is a legitimate issue, which I just answered my next question. Can men experience postpartum depression? Well, obviously yes, or we wouldn't be talking about it here. But I'll throw a trickier question in there. What percentage of men do you think experience postpartum depression or meet criteria for a major depressive episode within 1 year of having a child? What's your guess? Tiffany, were you here yesterday? I don't think you were, but that is a very, very good guess. All right, so we said 8 to 10% of new fathers do meet criteria for depression within 1 year of childbirth. Your intuition was just very good, Tiffany. So yeah, so not all that uncommon around men. And then, you know, if you, and this is just men, you know, that are meeting diagnostic criteria for a major depressive episode. If we were to expand this to men that experience symptoms of depression during the postpartum period, it would be much higher than this 8 to 10% rate. So, well, why is that? Isn't having babies just like all fun and games? Babies are so cute and fun. Why would men experience postpartum depression when we get to have little babies to raise? Yeah, complete change of lifestyle and value of time. For sure. Now we've got new obligations. You know, we're not just looking out for ourselves anymore. It's a major stressor, major life event. And I like that Aaron says, you know, it's a major life event, and any major life event is going to cause stress. And we can differentiate between positive stress and negative stress or distress, but it's still stress. And all that stress goes in the same bucket. You know, if you think about it like your beach ball, you're blowing your beach ball up bigger with positive stressors too. Yeah, not to mention less sleep that is kind of inherent in having children. There's a shift in your dynamic with your partner. You know, we've got new responsibilities, and then that baby is becoming a priority in the family, you know, and not just looking out for each other anymore. So excellent points. Oh yeah, and Will's pointing out he knows somebody that you know, went exactly through the same thing for all the things that we're talking about. So I think you're right on. You know, we can think about this as a major life event, new obligations, new stressors, financial stressors, health-related stressors, sleep stressors, you name it. You know, all these things are impacting men's experience of depression in the postpartum period. And another question for you is, how do you think symptoms of depression may look a little bit different in the postpartum period than they would at other times in the lifespan? And, you know, I was doing some more research, and the same things that I'm looking for here are likely to be more expressed in men in general too. So. What are some things you may notice about a man who is experiencing postpartum depression? Okay, yeah, shorter temper, more irritability, anger. Any other ideas? A few other things. So things you may not expect would be indecisiveness. So just having a really hard time making a decision. And I have been there in the postpartum period. One thing I haven't said today is I have a almost 4-month-old and a 3-year-old at home. And I know whenever we brought our second child home from the hospital, I could barely, a great example is I couldn't figure out what I wanted to eat for dinner. You know, it's like, let's pick something up. I don't know what to do. I don't know. Just, which is not, you know, that wasn't a normal thing for me to experience, or just like having such a hard time making decisions. So I definitely can relate to that feeling. And it's just this, all these different things going on. The one way that I kind of think about it sometimes is like, if our brain is like a computer, all the processing power is taken up, and it becomes hard to make decisions. And then another thing you may see is restricted range of emotion. So that idea of stoicism, maybe even exacerbated in men that are experiencing depression. And, you know, that's likely because they've learned to be stoic as a coping skill. You know, if it's not okay to express emotion, then you rely harder on that stoicism. And it's not like that men are saying like, oh, I'm just going to be stoic now because I don't want to express emotion. This is more innate. This is developed over time and culture, and it happens more naturally. I don't think people say I'm going into this, being really stoic, but you may see that more when men are experiencing increased stress. And to be perfectly honest, I know that that's something that I notice in myself whenever I'm experiencing more stress. So if you see me with a really flat face during this presentation, I may be more stressed. Okay, so next question for y'all. Is paternal postpartum depression treatable? Well, that's another easy one. Of course it is. And so common treatment approaches for depression, so like cognitive behavioral therapy, interpersonal therapy, are evidence-based treatments for depression, and antidepressant medication may also be helpful. Yesterday I was kind of giving an explanation of what cognitive behavioral therapy and interpersonal therapy may look like. Today, I'm going to talk a little bit more about why those treatment approaches may be better fit for men sometimes, but we'll get into that in the next couple of slides. Okay, so let's talk about men's utilization of mental health resources, and then we'll talk about strategies to improve mental health, and then a couple of those very specific things from a therapy kind of standpoint. So in the United States, women are a little over 1.5 times more likely to receive mental health services than men. We say, well, why is that? And then another thing, I always get curious in looking at data within the healthcare system that I work in, St. Luke's, and comparing it to what we know from national averages and things. And so I took a quick look at all the visits in our outpatient mental health clinic at St. Luke's here in Boise. It's just one of the clinics where we offer mental health services. But I looked at all the visits there, and then I split it up by sex in this case. And we found that 2/3 of the visits were for women, and only 1/3 of the visits were for men. So, about 2/3 of the services getting delivered across St. Luke's for mental health are being received by women. So I think, and then that begs the question, well, why are women utilizing services more than men? And there are several different reasons why. And I think you all have already been mentioning some of these things. But one of the things that came up is that men have lower rates of mental health literacy. So if you were to ask a panel of men to define what depression looks like, they would have a harder time doing that than a similar group of women. And so they don't even know what to call what they may be experiencing or what they're seeing in their peers. And the depth that men are being taught to deal with that is just like, well, man up, toughen up, suck it up, just keep going and work harder. And so that if that's your strategy, that can cause big problems. And then this other really big idea is that seeking help for mental health is likely at odds with those internalized views of masculinity. If I've learned that in order to be a man, I need to be self-reliant, well, then why am I going to ask somebody else for help? That makes me less of a man. And then once again, I can experience more cognitive dissonance, which increases my stress or distress. So there's a lot of reasons why this may be. They don't even know when they need help. And then if they do seek help, then they're fighting against those kind of internalized views or society's views of masculinity. And then I think another thing that I've got on these upcoming slides, and the reason I chose this image for the background here, is just like men have lower health, maybe lower mental health literacy in terms of like being able to understand what different mental health conditions are, they also probably have lower mental health literacy and what treatment looks like or therapy looks like. So one of the questions that came up yesterday is, like if you're trying to encourage a family member, loved one, friend who's male to get mental health treatment, how can you help support them in that? And one of the things that came up was, do men even know what therapy looks like? What do they think it is? And is that actually true? Is that what they think it's going to be? And, I put this image here that would depict more of like a psychoanalytic or psychodynamic kind of treatment where you're laying on a couch, you're not looking at the therapist. The therapist is just kind of commenting on what you're saying. It's very open-ended. I think what we find is that men may not be interested or as interested in just talking about their feelings, and for when there's no end in sight, because once again, that's going against a lot of these cultural ideals. And I'm not saying that wouldn't be helpful for men, but we're also probably very unlikely to change the entire way somebody sees themselves and their traits. And so, this kind of, or that type of view of therapy, maybe not the best fit for men sometimes. So we'll talk about what could be a better fit for some men. Okay, so next question for you all. I love these kinds of like brainstorming kinds of questions and to see what people think. How do you think healthcare systems, community agencies like Empower Idaho, indoor mental health providers can improve men's mental health? So we've talked about how culture is shaping men's mental health. We're talking about how men are less likely to utilize mental health resources. They're less likely to utilize healthcare resources. So what can we do as a society to help improve men's mental health? What do you all think? Yeah, that's a great idea, Nicole. So kind of demonstrating male peer support. So, like when Will was working as a peer support specialist, being a man who's willing to talk about his own mental health with other men can go a really long ways in making it feel more acceptable for them to do that. Excellent idea. Discuss with boys at an early age to allow the range of emotions. Yeah, make that okay. So just like in that video from the American Psychological Association, normalize the expression of emotions for boys. Make that acceptable. Keeping the conversation going, raising awareness. The more we talk about it, the less impact this outdated view. Yeah, perfect, Anna. And the most obvious one here is, like here we are doing a webinar on men's mental health. We need those kinds of things to potentially help reach more people. And, I love what Empower Idaho does. You record these presentations. So even men, that may not be willing to participate in a live presentation or webinar like this, maybe they will go back and watch it later on their own terms when they won't have me calling them out in the chat box to comment on their feelings. Okay, Will, we have to include expression emotions in elementary school curriculum. Yeah, that came up. I think Anna said that yesterday. That to normalize that in school can go a really long ways. So, the main point that you all are making is we have to change the cultural ideal of what is okay for boys to feel and express. Oh, I love what you're saying, Nicole. So giving them undivided attention when they do want to talk. So, and we may want to overdo that a little bit and reinforce them more for doing that. It's like, would you say the same thing to your daughter who was expressing how she was feeling as your son who was expresses as he was feeling? You may actually want to reinforce your son more and let them know how much you appreciate that, because they're not getting that as much from other places in society. Oh yeah. So you're saying like basically you may miss opportunities to make it more acceptable, and so we have to really pay attention to when men or boys are able to do that, so that we can really express that it's okay to be able to do that. Because if they're feeling really anxious about expressing that, and they get somebody's distracted or they blow it off, well, that can mean a lot to that individual, and the other person may not pay any attention to it at all. So if we're more intentional about that and recognize that it may be more difficult for men to do that or boys to do that, then that can really help them out. Excellent answers. Okay, so a few of the things that we were talking about yesterday, you all are kind of talking about the developmental aspects here. I kind of think about this from a healthcare system perspective. And one of the things that I think is super important, and I got on a little soapbox on yesterday, was I feel it's really, really imperative that we assess for common mental health issues where men are going to receive healthcare services. And I feel the same way about for women, but it may be even more relevant for men, knowing that we're less likely to pick up on symptoms of mental health conditions in them, and they're less likely to express that they could be having a problem. So doing things like assessing for mental health issues where men are receiving healthcare services can go a really long way. So I can speak for St. Luke's, and one of the initiatives that we've worked on over the last several years is putting behavioral health providers in primary care clinics. And along with that, we started screening for depression and suicidality in primary care clinics. And so, you know, if you go to a St. Luke's clinic, they're supposed to ask you or do a PHQ-2 screening for depression at least once a year. And some clinics are doing it every patient, every visit too. So we got to be asking about these things so that we can catch it, because people may not even be aware of what's going on with them or why they're feeling the way that they do. And if they don't know how to express it, they don't know what the problem is, they're less likely to bring it up. Other things that you all were very keen on, reducing stigma, talking about men's mental health and evolving masculinity. Whenever I was getting ready for these presentations, I was watching a lot of TED Talks, and they actually have a whole series about redefining masculinity. I found those very interesting. I'm going to end the talk today with a quote from one of those talks I watched. So we have to, you know, continue with this discussion and make it more relevant for people. And then making services more approachable. One of the things that I'm pretty passionate about is providing education and skills-based classes for people with mental health conditions. And so I do this in my insomnia clinic and teach an education class, and also teach some other health behavior change classes at the lifestyle medicine clinic. And the whole idea is that we don't necessarily have to get into the deep dark histories, you know, that people have, if we're able to provide them skills to help themselves now. And so I really feel that you can do a lot of good by teaching people skills from cognitive behavioral therapy, from things like mindfulness-based approaches. And if you can teach them skills to deal with what they're doing and help themselves feel better, that can go a really long ways. And not everybody needs to be in therapy, and nor we know they're not going to go anyways. So teaching them skills, and then you all are kind of bringing up this idea of doing more things in school. I really feel like we should be teaching skills to deal with stress, mental health, our thoughts, our feelings, our behaviors in elementary school. I think that could go such a long ways if people had more understanding of how their feelings were related to thoughts and behaviors, and learn that their thoughts are not true. They're not always true. They're not facts. And then that can be really empowering for people. So there's so much that we can do in education, you know, without actually doing therapy for people. You can get to a lot of the good stuff that way. Also doing more web-based services. So people definitely feel braver behind computer screens. And so, and actually COVID-19 has allowed for that a lot of mental health services are now being delivered via telehealth. And very interestingly, you know, that may make services more approachable for men sometimes, you know, that may be feeling anxious about going to a therapy clinic. Other things, this is what I was alluding to earlier. So increasing transparency about therapy. One of the things that I really like to do with my patients is talk to them about exactly what treatment is going to look like for them. I want them to know exactly what they're getting in, what they're themselves into. You know, we talk about how they ended up developing the problems they have, and we use that information to talk about how we're going to treat it. And so if people know what they're getting into from the get-go and what the expectation is in terms of length of therapy, like when we would expect to potentially see some changes, you know, if people are actively engaged in treatment, I think that can be really helpful to, once again, for anyone, but definitely for people that are more skeptical about therapy, which is the case for men. And then providing mental health services where men are already receiving healthcare services. In particular, primary care is oftentimes where that's going to come up. But then in other spaces like men's clinics, what I was talking about yesterday is a lot of these men's clinics are focused on very, very specific men issues like erectile dysfunction or testosterone replacement. So a quick Google search revealed that there are a couple of these like men's health clinics that are basically just places to get testosterone. Or at least that's the appearance from their website. They may offer more there, but my guess is that they don't really talk a whole lot about those other aspects of health, and it's just a place that you can go to get something like testosterone. So I would love to see clinics like that keep expanding the breadth of their services, and then even more formalized healthcare systems like St. Luke's or the VA, like the VA clinic, the men's health clinic was a erectile dysfunction clinic. There's incorporating more services into those clinics can make receiving healthcare more approachable. It doesn't have to just be about your testosterone or your penis to be a man. All right, and so a few more things. So this is very specific for people that are working as therapists or trying to support people in therapy or from that kind of standpoint. And interestingly, there were these guidelines for working with men and boys that came out from the American Psychological Association in 2018 that were kind of talk about the direct problems of masculinity, and then there was a pushback against those because a lot of men were saying, hey, being a man is not a terrible thing per se. Maybe we're reinforcing some of the wrong part or the unhelpful parts of masculinity, but there's some really great parts of masculinity too, and we don't need to totally change who we are in order to have better mental health. So these are some recommendations from Dr. Whitley, who's a social psychologist in McGill University in Canada. So, well, any idea? I'm curious. So any ideas that you all have about what could be more effective when working with men that may be different than what I was already talking about? What do you think would be more helpful for men to receive healthcare services, or specifically in therapy? I've talked about a few of these already, but. We're running a little short on time, so I'm not going to wait too long, but hopefully you'll type in some responses as you're thinking about this. So number one, like anything, do not jump to conclusions based on appearance, mannerisms, or attire. That was like one of the coolest things about working with the VA. It's like you cannot judge a book by its cover. Just because somebody looks a certain way does not mean that you know who that person is at all. So keep an open mind. That's if you're a therapist, hopefully you're well aware of that. But we've got to watch out for our own biases all the time. We're going to have them, but keep an open mind, and because as soon as you think you have something figured out, you're going to find that you don't. So Okay, so you had to, Aaron saying I had to work on building a relationship more, so building trust um, more than, you had to focus more on that than you did to be able to get a working relationship with women. Yeah, that's probably pretty wise. Okay, we have every man has his own story to tell, listen and learn. That very much goes along with what we were just saying. I'll give you some insight into one of my own biases. And so one of these patients I was working with at the VA, you know, had an appearance of a everyday Idahoan guy in his 60s. He wore coveralls and a ball cap, and or overalls and a ball cap, and you know, looked like he could have just stepped off of a tractor. And as I got to know him more, I found out that he actually, one of the things that he loved the most was being in the theater. And one of the things that he was so reluctant to do that may have helped him with his mental health was he wanted to get a pet, and particularly wanted a cat. And so, you know, I have this, it was just such a great lesson in not judging a book by its cover. You know, this guy was really a pleasure to work with, and I can only imagine, you know, what he went through throughout his life, growing up here in Idaho in a very rural place, and having, you know, different interests than people around him, and, you know, how he learned to deal with that. And so, yeah, fascinating story. So we don't know just by looking at somebody. So remember that there's no one size fits all solution. It would be so nice if we could say, just do this with men. But that's not the case. Main point, as with anyone, keep a really open mind. But there are some things that can be more helpful. So also knowing that there are different modalities of healing, and there's a lot that we can do through education, skills-based training, encouraging men to do other things that can help support their mental health other than just talking about it. And so I think as a therapist, recognizing that you may not have the same type of therapeutic rapport and emotional expression that you may be used to working with, but you can still help them out a lot by teaching them skills and pointing them in directions of things that can help themselves, and providing education and understanding and validating their feelings. Oftentimes men are going to prefer more action-based healing over talk-based therapies. Plenty of men out there just want to fix things. Just tell me what to do and I'll do it. Myself included, you know, that's oftentimes how I feel about things. Yeah, we want an instruction manual on what to do. And of course, there's not an instruction manual for everything, but there are definitely guidelines that can help out. And so therapeutic approaches like behavioral activation, where we're really honing in on specific behaviors and increasing behaviors that can help people feel better, could work really well for men, you know, that are just not going to be that interested in talking about their feelings. Do offer a choice of interventions tailored to the circumstance. Well, once again, that's the kind of thing that applies to everyone. But the kinds of things that you could think about would be things like exercise. You know, how often are you talking to your patients about exercise? That's something that people can exert control over, that can have huge benefits for their mental health. Same thing like going to peer support groups and self-help. We were talking about recommending self-help treatment manuals yesterday, because that can introduce people to what therapy or evidence-based therapies look like. And that can be really helpful, because then people know what they're getting themselves into. They know what the expectations are, and also, you know, how their therapist may be thinking about how their problems developed, or the different factors in their lives maintaining those problems or perpetuating them. Encouraging goal planning and skill acquisition to foster a sense of achievement and success. That goes hand in hand with what I was just talking about with those self-help kinds of treatment manuals, and giving people very specific treatment plans. And then watching out for difficult life transitions. So if men are going through breakups or divorces, one that I was talking about yesterday, and that we'll talk about on the next slide some, is other transitions that we don't always expect to be as difficult, but things like maybe kids going off to college, or retirement. You know, so these things that have the kind of mixed attributes, you know, there's some positives, but there's some negatives as well. And, you know, giving support and understanding that it's not all positive when we go through those things, even if it's a net positive. And then help men access social or community supports that can help foster resilience. And so hanging out with the right kinds of crowds that where maybe men are talking more openly about how they're feeling and are not reinforcing bad behaviors or unhelpful behaviors like using substances or promoting violence or things like that. Okay, then a couple, well, last slide here. So what aspects of masculinity could be beneficial to mental health? And if you're somebody working with men, you can take some of these ideals and use them to your and your patient's advantage by capitalizing on the aspects of their masculinity that they may really like or identify with. So some of the more potentially positive aspects of masculinity could be achievement, adventure, taking risk in certain situations, strength, bravery, confidence. These are not bad traits or unhelpful traits. They can be wonderful traits to have, and they can be wonderful traits for women to have as well. We don't have to, you know, just talk about them in terms of men. But the quote I'll leave you with was from one of these TED Talks I found from Justin Baldoni, and he is, I believe he's an actor and does some theater kind of work. But his quote was, see if you can use the same qualities that you feel make you a man to go deeper. Your strength, your bravery, your toughness. Are you brave enough to be vulnerable? Are you strong enough to be sensitive? Are you confident enough to listen to the women in your life? And I love that because you're using the traits that are considered masculine to go or to address some of these issues that can cause so many problems. Like, are you strong enough to express your emotions? That takes a lot of strength to do. And if you can just take a little bit more objective look at that and go a little bit deeper, you can turn these same qualities into strengths that could also potentially lead to problems for people. So, all right, well, it looks like we're right at 1 o'clock. I've got a few resources and references on my next slides, but I would be happy to answer any questions that you may have. Thanks for your participation, Nicole. It was great having you in the class. I understand if you have to drop off.